Yes, I'm Dr. Robert Klitzman. I am a professor of clinical psychiatry here at Columbia University Medical Center, where I also direct the Masters of Bioethics program, and I'm the author of Am I My Genes? Confronting Fate and Family Secrets in the Age of Genetic Testing. So in 2008, the Genetic Information Non-Discrimination Act, or GINA, went into effect, which prevents health insurers from discriminating against you based on your genetics. However, it does not cover life insurance, disability insurance, or long-term care insurance. So those insurers can discriminate against you. And there's subtle discrimination. So people have told me in my book, Am I My Genes? Women said, I told a coworker that I had the gene for breast cancer, and everyone assumed I'd be promoted to be the boss when the boss retired. The boss retired. I was not promoted. I think it's because of that I know that word got out and people would ask me how I'm doing, and I think that's why I didn't get promoted. Of course, it's very hard to prove that kind of discrimination. It's subtle. So the story is this. Almost every hospital in the United States today and every company involved in biotech and every drug company is trying to collect a big biobank. Companies realize, and universities, that if we can get biological samples, DNA, from lots of people and find out medical information about them, we could begin to identify genes that are related to the diseases they get and to what treatments are effective or not. So if I have the genes of thousands of people and I know, well, this 100 people, they got cancer and these didn't, I can try to find the gene involved. Similarly, if I know that these people all had a treatment for high blood pressure, and for these genes, this drug worked best, and for those genes, that drug worked best. So companies and medical centers are trying to collect big biobanks, which can help with science. Now, P.S., if you discover things, it is possible to patent things that you find. And so a lot of companies like 23andMe, I think, are thinking if I get a big biobank, that's valuable in itself because it could lead to patents. So a lot of companies and medical centers would like to be able to do research on leftover blood samples, and there's a big debate right now. What to do with them, whether or not I have to tell you what I find. If so, what do I have to tell you? So this past spring, the American College of Medical Genetics, or ACMG, came out with a list of 23 diseases, 56 genes, and it said that if anyone undergoes testing of their whole genome, the lab must look for these 23 genes and tell the patient, because those are the 23 genes that are 23 diseases for which there are very predictive tests genetically for serious diseases, and the diseases are treatable. Now, it's only 23 diseases, and most of them are very rare. Breast cancer is the most common of them. But the point is that companies do want to be able to do other stuff with your DNA. There's a question of whether or not it's linked to your name, whether or not they're going to access other kinds of health information about you. And of course, with electronic medical records, that's a concern. And whether or not they will go back and contact you over time. If we find something 5 years from now that we don't know about today, should we go back and find people? These are issues that are all being worked out through policymakers and et cetera at the moment. So a concern that many people have is that if I send a sample of my DNA through the cells in the inside of my cheek that I swab and send you, what companies like 23andMe can do is have a contract where you click down and scroll down and click I accept, that basically says that the company can do whatever it wants with my genetic material. It can use it to discover other stuff. They can use it for whatever purposes they want, providing they put it in the contract. Now, of course, many of us every day on the internet scroll down and click I accept and don't read the fine print. Sometimes I've tried and I have trouble understanding it, and I'm sure most people do, and that may be part of the intent, whether we go to Facebook or Google or anything else. So this is part of a larger problem in our society today of big data out there. It's the fact. It's wonderful that we have Facebook and Google and different things like that, and electronic medical records, but there are social, economic, political, ethical issues that we need to take into account to make sure there are safeguards to protect people's privacy. Of course, as you mentioned, I don't know what the validity of those contracts are all the time that 23andMe, et cetera, have, but I'm sure it says, or these companies, I'm sure, in some way put there that they can do whatever they want with the sample. Well, it's still limited, and the issue is we don't know what we may find in the future, and I think that there are people who are investing a lot of money in this area with the purpose not of coming up with medical treatments, which I think would be good, or helping with diagnosis and helping with the patient's health, but there are people who feel that we may find other kinds of genetics, or with marketing, I may, for instance, in the ideal world, let's say I have genes that predispose me for heart disease or high blood pressure, if they were to exist. And I should say we now, for most common diseases, do not have very predictive genes for most people. But let's say you were able to find genes associated with high blood pressure. You could then market to those people, if you knew who they were. You could say, guess what? You have a high predisposition to high blood pressure. Hey, guess what? Here's drugs you can take. Buy our drug, just click here, we'll have a doctor prescribe it for you, etc. So there's that potential, or for instance for depression, or many other things. Now, as I said, so I think that's what people are hoping to do, is to tie that with electronic medical records. And this is the great unknown. This is, will this be an efficient system, or will this be Brave New World? I think a lot of companies would like to find out people's diagnoses so that they could market to them directly through the internet. We already see direct-to-consumer marketing of various drugs on television. And of course, if we knew that this is the Facebook accounts of people who are depressed or people with cancer, the marketing could be more efficient. Now, genes could potentially play a role in that. As I said, so far what we know about genetics is that of all the thousands of diseases out there and millions of people, very few people, only a small percentage, do we have tests that will be beneficial for them today, the most common of which probably is breast cancer. And even there, I should say, if you have the breast cancer mutation, you have about a 50% chance of getting the disease if you have one of these two mutations. But only 10% of breast cancer is the genetic kind. So 90% of people with breast cancer who have the disease don't have those genes, and of people with the genes, only half of them get the disease. And that's not surprising when you think about the common understanding that a lot of things are mixtures of nature and nurture, that a lot of diseases are a mixture of not just genes, but what we eat, what we breathe, the kind of life we live, etc. But I think people are thinking that there's a lot of potential things to patent and market out there with the more data we can get, and that's obviously those are big national issues today about people collecting lots of data on us.